this is a clavicle, and we're looking at this from the superior view. So this is the top of the clavicle here. And if you were to feel your own sort of collarbone region, it's this bit that you would tap your fingers against. So features that we can see in this view are at the medial end, we can see it's called the sternal end of the clavicle, and that's because this articulates with the manubrium of the sternum. Then we have the shaft of the clavicle, which is bowed slightly anteriorly and then kicks back posteriorly towards this end, which is known as the acromion end of the clavicle, because it articulates with the acromion of the spine. So we can tell that this is a right clavicle because once we know the sternal and the acromial ends, you can sort of orient it, and the bowing, it should bow forward and then kick backwards. If you were to run your fingers down the shaft of the clavicle on the superior side, it should feel quite smooth, and that's because there aren't any muscle attachments in this area. However, if we turn it over and look at the inferior side, you can see, and you'll be able to feel as well, that this is a bit more ridged and grooved. So running down the shaft of the clavicle, pretty much like the whole way along, we have the groove for the subclavius muscle. So this is just a little ridge where the subclavius muscle can sort of cling onto. And then at the acromion end, we have this little tubercle just sticking out on the posterior side, what would be the posterior if it's in anatomical position. This is the conoid tubercle. And then running from the conoid tubercle to the end of the acromion end is the trapezoid line, which is actually quite faint on this individual, and it usually is quite faint. But if you were to feel it with your finger, you can usually feel a little roughened line. And again, this is a muscle attachment at this end of the clavicle. Over at the sternal end, we have this little depression here. So this is the groove for the costoclavicular ligament. And in this individual, it's quite pronounced. So we can see there's almost like a hole in the bone here, hole in the cortical surface anyway, and you can see through to the trabecular bone underneath. But this is just a variant of normal anatomy. You can see in another individual here, so this is the sternal end, and this is the inferior side. This is the costoclavicular attachment area in this individual, and instead of sort of being this indented depression, it actually pokes out from the bone instead, and it's almost like a little tubercle of a roughened area. So do be aware of the range of variation when you're looking at different individuals. Unfortunately, we can't really see the trapezoid line any better on this individual because the acromial end is snapped off, so we can't see how that would have gone if it was there.